Welcome to the We Level Up Treatment Center video series. In today's video we will discuss: what is Klonopin Clonazepam? Klonopin benzo is commonly used to treat seizures, anxiety disorders, and panic attacks. Klonopin usage enhances the effects of gamma-aminobutyric acid, GABA, a neurotransmitter that slows down brain activity, calming the body. The Klonopin pill is a prescription medication that should only be taken under the guidance and supervision of a healthcare professional. What is Klonopin used for? Klonopin Clonazepam is a prescription medication used to treat several medical conditions, including anxiety disorders and panic disorders. Klonopin uses include treating general anxiety and social and panic disorders. 2. Seizure disorders. Klonopin uses include treating several types of seizure disorders, including Lennox-Gastaut syndrome, akinetic seizures, and myoclonic seizures. 3. Restless leg syndrome, RLS. Klonopin uses include restless leg syndrome, which causes an uncomfortable sensation in the legs, accompanied by an urge to move the legs. 4. Sleep disorders. Klonopin sometimes includes sleep disorders or insomnia treatment. Klonopin is a potent medication and should only be taken as prescribed by a healthcare provider. It should not be taken recreationally or in higher doses than recommended, and it should never be abruptly stopped without medical supervision, as it may result in withdrawal symptoms. If you have concerns about your medication or the condition it's used to treat, please consult your healthcare provider. Additional Klonopin uses risks. Klonopin medication is a brand name for clonazepam, which belongs to the benzodiazepines family of medicines. Is clonazepam a controlled substance? Yes. Benzodiazepines, including Klonopin, clonazepam, are classified as controlled substances in many countries, including the United States. This means the government regulates them due to their potential for abuse, dependence, and addiction. Klonopin dependence cases may require benzo addiction treatment and a Klonopin detox. Off-label Klonopin uses. In addition to the above-mentioned conditions, Klonopin uses include off-label treatment at the guidance of a medical professional for conditions such as bipolar disorder. Klonopin may include treating mania symptoms in individuals with bipolar disorder. Post-traumatic stress disorder, PTSD. Klonopin uses may include adjunct medication to treat the symptoms of PTSD, such as anxiety, panic attacks, and sleep disturbances. Agitation or aggression. Klonopin uses may include treating agitation or aggression in individuals with Alzheimer's disease, dementia, or other conditions. OCD. Klonopin uses may include treating to alleviate symptoms of obsessive-compulsive disorder, OCD, including unwanted thoughts, urges, and compulsions. Klonopin is typically not a first-line treatment for most disorders, as other medications or therapies may be more effective for some individuals. Klonopin uses are for short-term treatment periods, as the drug can be habit-forming, leading to dependence and substance abuse. Medical professionals should closely monitor Klonopin's uses and treatment progression in all cases. The medication should be taken only as prescribed. Patients should always talk with their healthcare provider if they experience adverse reactions or need to adjust their medication Klonopin dosage. Long-term Klonopin use dangers. What are the side effects of Klonopin? Can you get high off Klonopin? Yes. Klonopin class of drug can be habit-forming and should be used cautiously and according to the prescribed dosage. Long-term Klonopin use can have both benefits and risks. One of the main concerns with long-term Klonopin use is the potential for dependence and addiction. The side effects of Klonopin abuse for those who take them regularly for a prolonged period include developing a tolerance, meaning that higher doses are required to achieve the same effect. This can increase the risk of dependence, an overdose of Klonopin, and withdrawals from Klonopin, which can be challenging to overcome. Klonopin drug classification. In the U.S., clonazepam Klonopin is classified as Schedule IV controlled substance, meaning they have a lower potential for substance abuse than drugs in Schedule III, II, or I, but still carries a risk for abuse and dependence. As a result, Klonopin and other benzodiazepines are only feasible to get with a prescription from a doctor or a licensed healthcare provider and should be used only as directed. Klonopin side effects. Klonopin Clonazepam can cause many common and less common side effects. The typical side effects of Klonopin include the following: drowsiness or fatigue, dizziness or lightheadedness, muscle weakness, loss of coordination or balance, memory problems, slurred speech, headache, nausea or vomiting, constipation, dry mouth, increased saliva production, blurred vision or double vision. Less common but potentially more severe side effects of Klonopin include allergic reactions, such as rash, itching, or hives, depression or suicidal thoughts, confusion or hallucinations, agitation or aggression, seizures or convulsions, difficulty breathing or shortness of breath, jaundice, yellowing of the skin or eyes, changes in heart rate or blood pressure. Snorting Klonopin. Do people snort Klonopin? Unfortunately, yes. Klonopin snorting is not a safe or recommended method of administration, and the medication should only be used as directed by a healthcare provider. If you or someone you're concerned with is struggling with Klonopin abuse or addiction, seek professional help and support as soon as possible. How long do Klonopins last? Suppose you have concerns about how long does clonazepam stay in your system? Or need a drug test? In that case, you should consult your healthcare provider or the testing facility for more information. Klonopin can generally be detected in the body for several days after the last dose. Here are some estimated timeframes for how long Klonopin may stay in your system. Blood. Klonopin can be detected in the blood for over 3 days after the last dose. Urine. Klonopin can be seen in urine for 4 to 6 days after the previous dose, based on the frequency and duration of use. Saliva. Klonopin can be seen in saliva for 5 or 6 days after the previous dose. Hair. Klonopin can be seen in hair for up to 90 days after the previous dose, based on the length and frequency of use. Klonopin overdose. If you suspect someone is experiencing Klonopin overdose symptoms, acting quickly and seeking emergency medical attention is critical. A high dose of Klonopin is considered any amount that exceeds the recommended dose or is taken for non-medical reasons. What is Klonopin overdose? Taking Klonopin at high doses can increase the risk of several adverse effects, including the following overdose Klonopin signs: drowsiness or sedation, confusion or cognitive impairment, dizziness or lightheadedness, slurred speech or difficulty speaking, impaired coordination or motor skills, respiratory depression or difficulty breathing, coma or death. Klonopin abuse treatment. Klonopin Clonazepam abuse treatment typically involves a combination of medical and behavioral interventions. The specific treatment approach will depend on the individual's needs and the severity of their Klonopin abuse. Klonopin rehab programs typically involve a combination of medical and behavioral interventions and may be provided in an inpatient setting or residential facilities. Medical management. Medical management may involve gradually tapering the medication to minimize withdrawal symptoms and safely discontinue use. In some cases, non-addictive medications may also be used to manage withdrawal symptoms or any co-occurring medical or mental health conditions. Behavioral therapy. Behavioral therapy, such as cognitive behavioral therapy, CBT, or dialectical behavior therapy, DBT, can help people develop coping skills and techniques to manage triggers or cravings associated with Klonopin abuse. Treatment may also help individuals address underlying issues, such as anxiety or depression, contributing to drug use. Support groups. Support groups, such as 12-step programs or peer support groups, can provide people with a supportive environment and community and a safe space to discuss their experiences with Klonopin abuse. Lifestyle changes. Lifestyle changes, such as adopting a healthy diet, regular exercise routine, and stress management techniques, can help individuals manage their overall health and reduce the risk of relapse. As Klonopin detox brings some of the most dangerous withdrawal symptoms of other drugs, getting professional help from We Level Up is in your best interest. Call us today to get treatment information and options. Each call is private and confidential. That's it for today. Please subscribe and hit the notification bell. Like, share and comment. We would love your feedback. Have a great day.